We hear all the time about how AI is changing industries, right? But in healthcare, it's doing something, well, something way bigger than just automating boring tasks. It's totally reinventing one of the most critical jobs out there, the medical coder. We're talking about a shift from being a data entry specialist to becoming an AI's co-pilot. And that is a huge deal. So why is this revolution even happening? Well, it all starts with this number. $500 billion. That right there is how much the US healthcare system spends every single year on billing and insurance paperwork. It's just an absolutely massive financial weight, and it's a huge signal that, the way we've been doing things, it's just not working anymore. And the fuel for that massive administrative engine? It's all about medical coding. You can think of it as the universal language of healthcare. Seriously. Every single thing that happens, a doctor's visit, a diagnosis, a procedure, it all gets translated into these special codes. And those codes are what make everything work. It's how hospitals get paid, how researchers track diseases. It's how public health officials make big decisions. It is, without a doubt, absolutely essential. All right, so here's our game plan. First up, we're going to dig into that massive problem, what I'm calling healthcare's billion-dollar paper cut. Then, we'll see how AI actually learned to code. After that, we'll talk about the incredible promise of all this automation, but we're also going to get real about the risks, and we'll wrap it all up by looking at the future, the new human coder. Okay, let's dive into Section 1, Healthcare's billion-dollar paper cut. We're going to look at why the whole administrative side of US healthcare is under so much strain. So, what's the core of the problem? Well, it's that we've been asking humans to do an almost impossible job. Think about it. Modern medicine is insanely complex. The main coding system they use, ICD-10, it has over 68,000 different codes. I mean, just imagine trying to perfectly pick the right one out of 68,000 options over and over again, every single day. It's just a recipe for mistakes, delays, and a whole lot of burnout for everyone involved. And when you put the old way next to the new AI-assisted way, wow, the difference is just night and day. Look, manual coding accuracy is around 85 to 92%. And that sounds pretty good, right? But hold on, that means maybe 1 out of every 10 codes is wrong. With AI, you're looking at 95 to 99% accuracy, and the time it takes, forget about it. We're going from, say, 20 or 30 minutes per patient record down to like 2 to 5 minutes. This isn't just a little tweak, this is a complete game changer. Okay, that leads us right into Section 2, AI learns to code. So how on earth can a machine actually do this stuff? The magic behind all of this is something called natural language processing, or NLP for short. Basically, it's the technology that teaches a computer how to read and understand human language. We're talking about those complex, detailed, and let's be honest, sometimes really messy notes a doctor writes. NLP allows the AI to not just scan for keywords, but to actually get the meaning and the context behind the words. It's pretty amazing. So in the real world, this works like a partnership. It's a team. The AI does all the heavy lifting first. It analyzes the patient's records, suggests the right codes, and even highlights the exact text that proves why it picked them. Then, the human expert, the coder, comes in. They're the boss. They look at the AI's work and can validate it, change it, or just say, nope, that's wrong. And here's the coolest part. Every time the human makes a correction, the AI learns from it. It gets smarter. So it's not about replacing people, it's about making them way more powerful. Which brings us to Section 3, the promise of automation. Okay, we know how it works in theory, but what about the results? Let's look at the data. Check this out, 97%. That's the accuracy rate that one AI platform from a company called Fathom hit in a case study. I mean, that is just incredible. It shows we can get super close to perfect coding. And what does that mean? It means hospitals get paid faster, there are fewer errors, and the data we use for research is just better. And it's not just about getting it right, it's about speed. The efficiency gains are just massive. We're seeing huge boosts from the big players in the industry. One system from 3M boosted coder productivity by 20 to 30%. Another from Optum cut the turnaround time by more than half. This is how you start to make a dent in that $500 billion administrative nightmare we talked about earlier. Here's a great example of this in action. Geisinger Health started using an AI from a company called NIM. Get this, they were able to automate over 90% of their emergency department coding. Just boom, done by the AI. So what happened to their human coders? They got to focus on the really tough stuff, that last 10% of complex cases that truly need a human brain and deep expertise. The AI handles the volume, the humans handle the complexity. And no surprise, because of results like this, the industry is going all in. The market for AI medical coding is projected to absolutely explode, growing from around $3 billion to over $10 billion in just the next 10 years. So yeah, this isn't some tiny little experiment anymore. This is quickly becoming the new standard. Okay, but whenever you see growth like that fast, that big, you have to stop and ask about the flip side, right? And that's exactly what we're gonna do in section 4, risks in the algorithm. It's time to talk about the ghost in the machine. So let's just ask it straight up. With all this incredible promise, all this explosive growth, what's the catch? And I think this quote really nails it. For a long time, the conversation was all about the tech. How fast is it? How accurate is it? But we kind of forgot to talk about the human side. How does this actually affect the people doing the job? And what does it mean for patients? The biggest risks here aren't just about code and servers. They're deeply, deeply human. So let's break down some of the biggest risks. First, there's algorithmic bias. This is a huge one. If the historical data the AI learns from has biases baked in, say one group of people was consistently underdiagnosed for something, the AI will learn and then amplify that same bias. Then you've got the black box problem. Sometimes these AIs are so complex that even their creators can't tell you exactly why it made a certain mistake. And how do you fix a problem you can't understand? On top of that, you've got huge worries about data privacy, the massive challenge of retraining the entire workforce, and the very real risk that only big, rich hospitals can afford this stuff, leaving smaller clinics behind. These are serious, serious challenges we have to face. But facing these risks head-on is what brings us to our final and honestly most important section, the new human coder. Because this is where we see that the story isn't about a job disappearing. It's about a job evolving from simple data entry into high-level data strategy. The whole focus of the job is shifting. In the past, a great coder was someone who was fast and can handle a ton of records. Volume was key. But the coder of the future, they're an AI supervisor, they're an auditor, they're a strategist. They're valued not for their speed, but for their judgment, their critical eye, and their ability to keep everything compliant and on the right track. And to step into that new role, coders need a totally new technical toolkit. It's not enough to just know the codes anymore. Now you need AI literacy. You have to understand how the machine thinks, what its confidence scores mean. You need to be a data analyst, spotting trends and claim denials before they happen. You need to be involved in automation governance, basically writing the rule book for the AI. These are some seriously high-level, sophisticated skills. But you know what's even more important? The skills that an AI will just never, ever have. Look, an AI can suggest a code, but it can't use critical thinking to understand the full story of a complex patient. It can crunch numbers all day long, but it has zero ethical judgment. It can't ensure fairness, and it definitely can't walk down the hall and have a strategic conversation with a doctor and an IT guy to solve a problem. These uniquely human skills, they're becoming more valuable than ever. And really, that's the bottom line here. The future doesn't belong to the AI. It belongs to the humans who are smart enough, skilled enough, and adaptable enough to manage it. The people who can supervise it and use its power wisely. So let's totally reframe this whole conversation. The story we always hear about AI replacing jobs, it's the wrong story here. The human coder isn't going away. They're becoming more important, more strategic, more valuable than they have ever been. This isn't a threat to their job. It's a promotion. The only real question left is, who's ready to step up and take